Hi, I'm from Group 10, and we would like to share with you some things we know about type 2 diabetes. Did you know November is Diabetes Awareness Month? So, how aware are you about type 2 diabetes? According to the Canadian Diabetes Association, diabetes is a chronic disease in which the body either cannot produce insulin or cannot properly use the insulin it produces. In order to balance this, the pancreas makes extra insulin, but it is not able to do this forever. You know, it's more common to get diagnosed with type 2 diabetes than the common cold. Now you might be thinking, what should I look for? Well, blurred vision, increased thirst, constant hunger, unusual weight gain or weight loss, periodic urination, and wounds that are healing slower than usual. Type 2 diabetes can happen at any age, but the older you are, the more likely you are to get it. Men are more susceptible to developing diabetes than women, but women aren't safe either. Those who have a family history of type 2 diabetes, those who are at a higher weight than their typical BMI, those who lack physical activity and have an unhealthy diet are at greater risk. Type 2 diabetes is more dominant among ethnic groups like Native Americans, Africans, Hispanics, Asians, and some Caucasians. So what's the cause of all this? I'm glad you asked. Well, genetics, like heredity and those with one or more genetic mutations, as well as lifestyles, like lack of exercise, poor diet and not enough fiber, and obesity are large risk factors. Medical concerns can also contribute to type 2 diabetes. These can be gestational diabetes, polycystic ovarian syndrome, metabolic syndrome, excess glucose to the liver, and non-functioning cells or broken beta cells. Now I know what you're thinking. Is there a cure? No. But it's totally manageable. But we'd want to prevent it, so how do we do that? Ever wonder why parents always said,
"Eat your vegetables"?
You need to exercise.
Well, that's right. We need to manage our bodies by eating regularly, eating healthy, taking our vitamins, and controlling our blood pressure levels by staying calm, cool, and collected. Exercise on a regular basis. Make sure to schedule your yearly physicals for organ and muscular functioning, and eye exams for blurry vision. Also, keep your immunizations up to date. Take care of your teeth. Yes, your teeth have a lot to do with diabetes in regards to gum decay or cavities, making it easier for your body to shut down and become susceptible to diabetes. Pay attention to your feet. Losing feeling is a result of low blood sugar and can lead to type 2 diabetes. Control your cholesterol levels and quit smoking and consuming alcohol, cause that stuff's bad for you anyway. You don't need it. And here's a treat for you, treatment options. It's simply a lifestyle change, but it doesn't happen overnight. We would need more physical activity, to lose weight and eat healthier, take doctor-prescribed insulin therapy and medications, and monitor blood sugar consistently. So how can you find out if you have type 2 diabetes? Ways in which a person can be diagnosed are glycated hemoglobin test, blood sugar tests, fasting blood sugar tests, and oral glucose tolerance tests. And some may say, isn't it complicated? Well, let me break it down for you. Diabetes does have some major complications it can bring to the table, such as hypoglycemia, which is where the blood glucose level would be lower than normal, hypertension, which is a rise in high blood pressure, heart attacks, and blindness. Basic complications of type 2 diabetes are nerve damage, eye problems, hearing impairment, heart and blood vessel damage, kidney disease, and foot damage. Now you know a little more about type 2 diabetes. Diabetes, anyone, anywhere, anytime.
Are
Created using Powtoon.